pelvic floor problems can lead to a host of other issues for men and women. Dr. Kimberly Sullivan of Sullivan Physical Therapy is here to tell us about this diagnosis and how to treat it. Thanks for coming today, doctor.
Thank you so much for having me here.
So what are some of the other issues that can be a problem for men and women?
So men and women's health physical therapy is basically, we say we treat from here to here. It would be like urinary incontinence, fecal incontinence, gas incontinence, constipation, irritable bowel syndrome, in addition to pelvic pain. Pelvic pain would be like sitting with pain, pain with intercourse, pain with gynecological visits, pain with tampon insertion.
Yeah, so something, when you're talking about urinary incontinence, you were suggesting that Kegel exercises are a good therapy for that, for preventing or for alleviating that problem?
Yeah, so Kegel exercises are basically the name of pelvic floor exercises. Just like you do crunches or sit-ups for abs, pelvic floor exercises would be Kegels.
So what is the process for doing that the right way?
Yes.
How often should we do it? What do we do?
Definitely. So most people do it incorrectly. Everybody's been taught to like sit at the stoplight and squeeze their pelvic floor.
I was just going to say, that's what I always heard. Hey, if you see me at the red light, just keep looking me.
I know, but how many people actually leak at the stoplight?
Right.
So what you should do is, first of all, in order to do a Kegel properly, the pelvic floor muscle connects from our pubic bone to our tailbone and then between our two sit bones. So if you're doing it correctly, it should be like a pull up, up and in, not a down out like you're having a bowel movement, but actually a pulling up and in. So if you're doing it correctly, it would be like stopping the flow of urine or stopping gas. It should be quick contractions, because we have two types of muscle fibers. We have ones that respond quickly, like sprinting, and then we also have ones that respond long-term, like marathon running. So you want to do a quick contraction about 30 times, just squeeze and relax, squeeze and relax, and then you want to do about 10-second holds for 30 times if you can. You want to work up to 30. But most importantly, you want to do it in every single position. Lying down, sitting, and standing
up.
Because most people leak standing up because that's the most difficult position.
And I know this is sensitive subject matter. It's not always something someone wants to come forward and talk about. And you dedicate your practice solely to this. You're very discreet and helpful with this. So we appreciate it very much.
I just appreciate you having me on here today, because there's so many people out there that are suffering in silence. There's 1 in 4 women will have a pelvic floor dysfunction in her lifetime, and 1 in 6 men. So it's very important for us to get the word out that you don't have to suffer in silence.
Well, thank you so much for being here today. We appreciate it, doctor.
Thank you.
And Sullivan Physical Therapy is located on High Meadow Drive. Give them a call at 512-335-9300 or go to sullivanphysicaltherapy.com for more information.